Hi, I'm Jennifer Bell. I'm the Communications Senior Director here at the Poe Center, and I'm here with Ann Rollins, Executive Director, and Rachel Pullman, Nutrition and Physical Activity Senior Director. And we're doing this special video to raise awareness about the programs and resources the Poe Center is able to offer with funding from SNAP-Ed. You may have heard that the House of Representatives narrowly passed a federal budget bill that includes eliminating the Supplemental Nutrition Assistance Program education, which we refer to as SNAP-Ed. SNAP-Ed is the primary federal program dedicated to delivering nutrition education to millions of individuals and families through trusted community organizations. The Poe Center is one of those organizations. So we felt it was important to take this opportunity to talk more about SNAP-Ed and why it's so critical to the work that the Poe Center does. So Ann, what is SNAP-Ed and how does it support local communities?
So SNAP-Ed is a nutrition education program for all ages from preschool to senior adults and has shown very effective results. Over the past 20 years, Poe's been involved with SNAP-Ed, and about 50% of our budget is funded with this federal flow-through program funding. And our results in the last impact report have shown that participants have increased healthy eating, they are more physically active, they also are shopping and learn more effective budgeting practices.
So it's a program really to set families up for wellness.
It really is. And that aligns with our mission.
Right.
That we provide universal prevention education in all the health areas. And nutrition and physical activity, when we look holistically, it intertwines with all the other areas. So it threads into all of our healthy behaviors that we teach here at the Poe Center.
Rachel, what does SNAP-Ed look like in action at the Poe Center?
So there are three main branches of SNAP-Ed at Poe. The first one people are probably the most familiar with, and that's our direct education or our programs. On an average year, we have programs for about 9,000 individuals. Many of them come to multiple programs, and if you include that, it comes up to 20,000 contacts. Our programs focus on nutrition education and physical activity education, and that is from garden to kitchen. It's a wide variety that we're doing.
So we're here in the Nutrition and Physical Activity Theater, and on a school day at Poe, this theater's full of kids using the MyPlate to learn about the 5 food groups, and that's that direct ed you're talking about.
Right. So every program includes learning those basics of making healthy food choices, ways to support your body so that your body works at its best.
I know we do a lot of social marketing.
Yeah, so that's the other branch. So that's the second branch. So we've got direct education. Social marketing is a huge component of what we do. Every summer, we have a huge social marketing campaign across more than 13 counties that includes promoting things like drinking fresh water, gardening, eating more fruits and vegetables, being more physically active. And we know through survey results that those who have seen the campaign, 70% say that they've made a behavior change. And our new campaign that we'll hope you'll see this summer is focused on parents being and guardians being the influencer for their child, and that your habits and behaviors your child picks up. And so having those healthy behaviors, again, drinking more water, fruits and vegetables, more activity.
I'm very proud that campaign reaches on average about 9 million people a year. And the third branch?
So the third branch, the official title of it is Policy, System, and Environmental Change. But what that really means is we are partnering with communities, helping them identify ways that they can make and support healthier environments. So for instance, in Fuquay-Varina, we helped resurrect the Fuquay-Varina Growers Market, which has about 800 people attend every week. And we were able to get benefits there to support WIC and SNAP benefits, as well as having senior days and adding a summer meal site. So that was all done with support through SNAP-Ed. And we are doing that with partners across the Piedmont and across North Carolina to help create healthier environments and increasing access to fresh fruit and vegetables.
I love the story from the Fuquay-Varina Growers Market about a senior who was using their food voucher and thanked us because they felt like they were the forgotten population. And here we were coordinating efforts to directly serve them. And that's all because of our funding from SNAP Ed.
That's right.
And we know in Wake County that we're the second or third largest growing senior population in North Carolina. So the need is not going away, it's increasing. As we add 65 people a day in Wake County, many of those are seniors that may need these benefits to be able to have a healthy meal and be physically active and promote healthy behaviors.
And to your earlier point, that funding, then we're really empowering from pre-K through to senior adults, whether that's in this theater with a field trip and a 30 second graders, or at the Fuquay Varina Growers Market with seniors, or our very popular Stay Strong, Stay Healthy exercise program for seniors, which I love to observe occasionally. So, Rachel, in your experience, you've been with Poe for 10 years now. In your experience, what kind of impact have you seen as a result of the programs that Poe is funded by SNAP Ed?
There's been impact on so many different levels. Every year there's a story that just goes into my heart. And you just mentioned our exercise program for senior citizens, Stay Strong, Stay Healthy. And it's one of my favorites. It's really focused on strength training and flexibility to improve balance among senior citizens and help increase, allow people to continue to live independently. And we have seen, in particular, there's two different gentlemen that were both using walkers at the beginning of the program. One of them was able to stop using his walker by the end of the series and come in unaided like that. And the other one, he was living with his adult children because he needed help with care. And they commented to me that they noticed at home, anytime he needed to get out of his chair previously before the program, he would always be calling out repeatedly, to come help him. And then partway through the series, they noticed he stopped calling out. He was able to get up and move around the house freely on his own.
That is very moving and impactful. I love the stories about our gardens in the community. Can you share an example of those?
Yeah, so the garden programs have been very popular, and there's been a very large demand for those. People are just, especially after COVID, people are very interested in growing their own food and having more access to fruit and vegetables. One early child care center that we partner with in particular, they said, at the beginning of the year, they say the families are very hesitant about fresh food and they're unfamiliar with it. They don't know what to do with it, how to prepare it. And they really engage the family in the garden program, and it's an urban garden setting. And so the families are all responsible. They adopt different planters, and the kids are like, you can't let my plant die. Put a lot of pressure on them. But they notice, as the school year goes on, the whole family is watching. Are like, when is that going to be ready? When do we get to take that home and eat it? And they get really excited, and their interest in just how comfortable they are around fresh food really increases. And
so they're outside, which improves mental health. Mm-hmm. They're getting physical activity. They're learning where their food comes from, and then they're excited about eating it at home. Yeah. That's really full circle.
And then our Cookwell Kitchen.
I was going to say, let's give them a Cookwell Kitchen story.
Sure. Well, in the Cookwell Kitchen, they can take food that they've grown or we have in our teaching garden, take it to the kitchen and work with our health educators on how to transfer some recipes that they may be used to, or maybe something like Swiss chard that they've never heard of, and they take it and learn how to cook that and to season it, and it's a healthier food that many times they're enjoying and taking home and cooking themselves.
Yeah. Watching kids at Healthy Habits Camp, another SNAP Ed favorite, because we have 60 campers every summer, totally take over the building for a day camp, and they come into the Nutrition and Physical Activity Theater, learn about the 5 food groups. Then we take them to the garden. They learn about growing the foods that they just put on the My Plate. And then we walk them down to the kitchen to make a snack with them. I mean, it is.
And on the way to the kitchen, they go by the beehives because you can't have food without bees.
Yeah, that's right. We do it all here at the Poe Center. We do. So, Anne, to sum up our conversation here, what is the most important thing you would like for people to understand about SNAP-Ed and our work at the Poe Center?
All of this work that we're talking about and the examples that we have are funded through SNAP-Ed, and it's in jeopardy right now. We just want to educate our viewers, but also our community, that this is the only national nutrition education program for the nation, and we feel like it's essential. We feel like it prevents chronic disease, and we feel like it's worthy of being supported through the federal government, through the states, and to us in the community that are working hand in hand with these families that are low income. And much of North Carolina is rural, and we know that it's really important for them to be able to get fresh foods because there are a lot of food deserts still in North Carolina.
I would like to add to that it really does support local farmers as well.
Yes.
It provides a lot of income for them.
And food pantries and schools and feeding kids when they're out of school. I mean, it's
Our summer lunch program is about to start on June 25th. Well, thank you, Anne. Thank you, Rachel, for taking the time to do this video. I know for me personally, being a part of this organization for the past 10 years and having the opportunity to work with funding from SNAP-Ed to help tell the Poe Center story and promote these important messages has been personally gratifying. So I just want to invite our friends and followers that if you've had a positive experience with SNAP-Ed, maybe you have your own story, or you've participated in one of our programs, please share that. You can share that at the hashtag SNAP-EdWorks. We've also provided a link to a form where you could submit that. It's in the description of this video. And then finally, share our video, because our primary goal is to raise awareness and tell this story that people are aware of how SNAP-Ed works in their communities. So thank you again. Thank you to you. And remember, SNAP-Ed works.